Good afternoon, everyone. Our group presentation will be about diabetes mellitus and the effect on the health status and life expectancy of Aboriginal and Torres Strait Islander people in an urban community. Firstly, we would like to say an acknowledgement of country. We would like to acknowledge the traditional owners of the land on which we meet today, the Darug people of the Darug Nation, and pay our respects to elders past and present. The members of our group are students of Western Sydney University, Parramatta. The students are Laura, Tina, Abdul, and myself, Ruby. Laura researched the links between culture and health, Tina researched the social determinants of health, Abdul researched diabetes and the effect on health status and life expectancy, and myself, I researched how to demonstrate culturally competent and safe care as a registered nurse. Our presentation today will discuss the links between culture and health, the connection to health and country, what is health from a Western point of view compared to that of an Aboriginal and Torres Strait Islander point of view, the social determinants of health, the Close the Gap campaign, diabetes and how it affects individuals and communities, who benefits from current healthcare policies, and how nurses can demonstrate culturally competent and culturally safe care. The links between culture and health and the connection to health and country. Aboriginal and Torres Strait Islander people originally relied on bush medicine and traditional healers to restore the health and well-being of their community members. This was achieved by being on the land and connecting with the land or country in a spiritual way, referring to elements in the natural environment such as the earth and the trees and connecting their surroundings to Mother. For instance, if a tree was dying, they would sing and pray to the tree to bring it back to life. The Mother in return gives health back to the community. This spiritual connection to country and to Mother is very profound and goes back generations and generations. There is a strong sense of community whereby the health of the community can take priority over the health of just one individual. Elders are respected members of Aboriginal and Torres Strait Islander communities, providing leadership and guidance. If an elder was to become ill, the members of the community would come together to sing, pray, and use traditional medicine and healers to replenish one's health. This practice is heavenly guided by the spirituality and their connection to country and to Mother to restore health back into their community. Part of Aboriginal and Torres Strait Islander culture involves multiple members of the community being involved in health practices and the decision-making process. This includes mothers, fathers, grandparents, siblings, aunties, uncles, and elders. Healthier outcomes are better achieved when family and community members are actively involved, when traditional language, ceremonies, healing, and spiritual practices are incorporated into their care. Maintaining this connectedness to culture and spirituality strengthens their mental and physical health, enabling better health outcomes. There is a belief that Western medicine is able to treat and cure symptoms of an illness, but is unable to remove the cause of an illness. That is where traditional Aboriginal medicine comes into play. What is health? The World Health Organization has a Western approach to the definition of health. It describes health as being a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The Aboriginal definition, however, has a more all-encompassing approach to defining health, whereby it is not just physical well-being of the individual, but it incorporates the whole community's well-being in terms of cultural, spiritual, emotional, and social health. The social determinants of health. These include culture, income and social status, social support networks, education and employment, physical environments, biology, genetics and gender, personal health practices and coping skills, healthy child development, health and social services, and social environment. In an urban setting, the most prevalent social determinants of health that influence the health of Aboriginal and Torres Strait Islander people with diabetes are income and social status, social support networks, and education and employment. There is not an equal opportunity for Aboriginal and Torres Strait Islander people to achieve the same health level as non-Indigenous Australians, due to a long history of systematic bias in the health system that still exists to this day. Income also greatly affects the health of Aboriginal and Torres Strait Islander people. Income provides financial stability, and a lack thereof can impact the individual's ability to access healthcare services, obtain quality food, or even pay for medications. The World Health Organization's fact book on the social determinants of health mentions that the more time someone lives in a disadvantaged situation, the more likely they are to experience a variety of health issues, such as diabetes. Living below the poverty line and being excluded from society increases risk of developing illness. Education and employment play a role in influencing the health status of individuals also. Aboriginal and Torres Strait Islander people that are strongly connected to their culture are more likely to finish school compared to those who are not. Completing higher levels of education has been linked with better health outcomes. Job insecurity has a negative effect on health and can lead to an increased risk of premature death. Social support networks to refer to how a person receives care and support from friends, family, and community members. Aboriginal and Torres Strait Islander people that have a strong ties to their culture and participate in cultural activities have more positive outcomes than that of those who do not. When people actively participate and are engaged in cultural practices, it helps to enhance the sense of community amongst members, which therefore improves their quality of life. It helps to provide a support system, framework, or buffer to outcome adversities, such as living with chronic diseases like diabetes. What is Close the Gap? The Close the Gap initiative is a campaign with 7 targets that aim to eliminate the health inequalities amongst Aboriginal and Torres Strait Islander people by the year 2030. These targets are: to halve the gap in child mortality by 2018, to have 95% of all Indigenous 4-year-olds enrolled in early childhood education by 2025, to close the gap in school attendance by 2018, to halve the gap in reading and numeracy by 2018, to halve the gap in Year 12 attainment by 2020, to halve the gap in employment by 2018, and to close the gap in life expectancy by 2031. The most notable target being to close the gap in life expectancy. Whilst the rates of mortality amongst Indigenous people have reduced by 14% since the year 1998, this target has still not been on track. The following video we would like to play for you is called the Close the Gap Campaign for Indigenous Health Equality, a Decade in Review.
Since the landmark referendum in 1967, the fight for equality for Aboriginal and Torres Strait Islander people has been long and relentless, weighed down by the injustices of our nation's history. The hope for genuine change has often been met with the disappointment of empty promises. The year was 2008, and on February 13th, Mr. Rudd made a formal apology to Australia's First Peoples, acknowledging the shame and harm of the stolen generations.
For the pain, suffering and hurt of these stolen generations, their descendants and for their families left behind, we say sorry. To the mothers and the fathers, the brothers and the sisters, for the breaking up of families and communities, we say sorry. And for the indignity and degradation thus inflicted on a proud people and a proud culture, we say sorry.
It was an apology that was long overdue and gave hope for the future. The Prime Minister's statement declared a vision to close the gap on health and life expectancy for Australia's First Peoples. In 2008, the Council of Australian Governments committed $4.6 billion towards that vision. All across Australia, communities banded together to close the gap.
It's not about us as a mainstream health service going into a community and saying, this is what we want you to do. It's about, let's work together.
Organisations rose to the challenge, committed to making change happen in our lifetime.
When the Prime Minister announced that they were going to do a progress report on the Close the Gap commitments, the Close the Gap Steering Committee decided that we would also pull together an independent report which would shadow the government's report. The Steering Committee thought it was very important to get the advice and expertise from the people which work on the ground in Aboriginal and Torres Strait Islander health. The report found that it's still a long way to go to live up to these commitments.
We advocated for community-owned and run health services to improve health outcomes for our First Peoples.
One of the challenges is always going to be getting it right at the local level, listening to the different needs at local areas. Like, it's not about having one size fits all.
Aboriginal and non-Aboriginal people came together to close the gap.
It's really vital that we do have our non-Aboriginal health workers in our mainstream service gaining an understanding of what it takes to maintain that partnership. From little things, big things grow. And it's happening right here.
We have strived to reach the bright future that Rudd envisioned.
A future where we harness the determination of all Australians, Indigenous and non-Indigenous, to close the gap that lies between us and life expectancy, educational achievement and economic opportunity.
But after 10 years of striving, that future remains out of reach.
What I would hate to see is the issue of Aboriginal and Torres Strait Islander health falling to the back burner, to governments not being interested anymore, to the public, getting a little bit fatigued with what is obviously a really difficult situation. It's not just a fad or an issue that's important now, it's something that matters to communities because it's their people's lives.
What we'd like to see from government is a commitment with Close the Gap within a generation, that it remains front and centre for the next 20 years. It needs to have a very focused approach, and it needs to be relevant to the communities which it is actually designed to improve the health for.
Our governments are failing Australia's First Peoples. Since 2008, when the government first set targets to close the gap, only 3 of the 7 targets are on track. Aboriginal and Torres Strait Islander leaders have expressed bitter disappointment at worsening health indicators. We must demand that governments work closely with Aboriginal and Torres Strait Islander people and organisations to redesign the strategy, ensuring that it's sustainably resourced and followed through. In the decade since our government first pledged to close the gap on Indigenous health and life expectancy, the gap has only grown bigger. Our work is not yet done.
What is diabetes mellitus? Diabetes mellitus is a lifelong condition in which the pancreas is unable to produce sufficient amounts of insulin to maintain a normal blood sugar level. It is a chronic health condition that requires daily care and frequent monitoring. Many factors can affect blood sugar levels, but the most well-known are lifestyle factors such as diet and exercise. An important aspect of diabetes is to create awareness about the lifestyle factors that can lead to the development of diabetes in an effort to reduce the incidence amongst Aboriginal and Torres Strait Islander peoples, as they are 3 times more likely to develop this condition compared to non-Indigenous Australians. In 2012 to 2013, the rate of hospital complications was 6 times higher amongst Aboriginal and Torres Strait Islander peoples than that of non-Indigenous Australians. This is why it is important to provide education to those already diagnosed with diabetes to help reduce the gap of life expectancy. Education is vital in ensuring positive outcomes for our patients. This graph demonstrates the proportion of Aboriginal and Torres Strait Islander people diagnosed with diabetes compared to non-Indigenous Australians in relation to their age as a percentage. Between the ages of 18 to 24, the percentage of adults with diabetes is relatively low. Moving into the age group of 25 to 34, you can already see that the percentage of Aboriginal and Torres Strait Islander people with diabetes is higher at 3% compared to 0.7%. This is again increased to the ages of 35 to 44. with 9% incidence compared to 3% incidence amongst non-Indigenous Australians. In the age bracket of 45 to 54, the incidence among Aboriginal and Torres Strait Islander people has doubled, whilst that of the non-Indigenous percentage only increased by 2%. In the 55 years and over bracket, you can see that the percentage has almost doubled again, while the non-Indigenous incidence only increased by 6%. This graph highlights the incidence difference and the incidence of diabetes in Aboriginal and Torres Strait Islander people compared to that of non-Indigenous Australians, which goes to show why it is an important health issue that needs to be addressed in order to reduce the gap in life expectancy. How does diabetes affect people in Aboriginal communities in an urban environment? There are cultural, socio-economic and community influences that have an effect on the people living in an urban environment with diabetes. Cultural practices influence how health is viewed and treated. Socio-economic status can affect the affordability of healthcare needs as well as the ability to access services. And community members in the Aboriginal and Torres Strait Islander community have a strong influence on the health needs and practices of their own community members. Current government health policies can be quite narrow-minded and limited in terms of flexibility. They are not always targeted towards the specific healthcare needs of Aboriginal and Torres Strait Islander people who are living with chronic health conditions such as diabetes. They are narrow-minded because they do not incorporate health into healthcare practice, thus not adhering to person-centred care. In order to benefit from current healthcare policies, individuals must participate in education to better understand their healthcare needs about diabetes from a Western perspective. Healthcare policies need to incorporate culture, traditional medicine, traditional healers, and a number of family and community members and elders in order to truly be beneficial to the Aboriginal and Torres Strait Islander people. How to demonstrate culturally competent and culturally safe care as a registered nurse. Undertaking research into Aboriginal and Torres Strait Islander culture is an important step in being able to incorporate culture into practice. As nurses, we need to be respectful and appreciate different cultures and understand how they influence the healthcare needs of our patients in order to deliver culturally safe care. We need to remain flexible and allow for family and community members to be involved in the decision-making process instead of a two-person per patient maximum. It is important to realise that some of the current healthcare policies that are in place are not going to be supportive of traditional healing practices and non-Western medicine. As nurses, we must recognise that there is systematic bias in the healthcare system and that we must remain non-judgmental and always advocate for our patients. Knowledge is power. The more we learn about Aboriginal and Torres Strait Islander culture, the better we meet the needs of our patients. In doing this, we can develop a strong line of communication between ourselves and patients, which will improve compliance with diabetes management, therefore improving positive patient outcomes. In conclusion, we have discovered from our research that there is a significant gap in the healthcare status and life expectancy of Aboriginal and Torres Strait Islander people compared to that of non-Indigenous populations. We have come to realise that there is a systematic bias that exists in the healthcare system, which can be a barrier to achieving the same positive outcomes as non-Indigenous Australians. We learned that the incidence of diabetes is 3 times more common in Aboriginal and Torres Strait Islander people and contributes to the gap in life expectancy and health status amongst members of our Indigenous community. The social determinants of health have a great influence on the health status, and these need to be recognised in order to understand how they affect the health of our patients. As future registered nurses, we need to realise the importance of incorporating culturally safe and culturally competent care into healthcare practices every day. This is to ensure we do not only meet the needs of our patients and provide person-centred care, but we make sure we maximise the healthcare benefits to our patients and reduce the gap in life expectancy amongst Aboriginal and Torres Strait Islander people in our community.